A selfie, blame it on social media and online dating, or you can credit medicine and technology. Cosmetic surgeons say they have seen a dramatic rise in people wanting to fine-tune their chins.
Yeah, but not one method fits all. And our Joyce Evans takes a look at 3 popular double chin erasing techniques.
Some people have famous chins. Some take it on the chin. But nobody wants a double chin.
Right under here.
Usually I can kind of hide it with my goatee.
Even when I'm talking, I try to keep my neck up. I feel like a turkey or a chicken. Everybody's like, oh, it's not that bad. Well, yeah, because you don't look at it every day. And I don't like it.
None of them plan to look at theirs anymore.
I'm 34, why not take care of it now?
Never before have there been so many options to keep your chin up.
Things we do for beauty.
But deciding which thing is best to chisel yours may take a little research and cold cash.
And now I'm at an age where it's time, it's all about me.
Audrey's about the radio frequency method.
Audrey is the ideal patient for this technology.
It's not the newest, but it's one of the most non-invasive, inexpensive procedures out there.
Are you nervous at all?
I'm very nervous, but this feels so nice.
30 minutes of heating and massaging aimed at melting fat and stimulating collagen production.
Not too hot?
Not too hot.
And for her double chin issue,
Feel spotlight.
plastic surgeon Stephen Davis determined she may get much more for far less with 2 treatments of Forma to start off.
She doesn't have a lot of fat. She doesn't really have a lot of skin laxity.
And she doesn't need a lot to maintain it for several years, he says, especially if she does the face and neck, but not ideal for somebody who has more fat and looser skin.
More expensive.
More expensive, more treatments, and that's why other options may be less expensive because you may only have to do that once.
Or twice, as he recommends for Linda using Kybella.
This is what we're focusing in on. Although there may be some other things here, Kybella really is supposed to be used to treat this entire zone.
The newly FDA-approved product involves cutting, sticking, some pain, and swelling.
It's right in that pocket of fat, right there.
A bit more invasive, much more expensive. It is the first injectable acid solution aimed at dissolving fat, but only in this specific area.
What would happen if you went outside the zone?
Potential problems are there are nerves and blood vessels that could be hit. Okay, Tara.
She'll have to do a different procedure to tighten her jawline, which he says will work well for Linda. This should take about a month for her to see some improvement.
That's it.
That is crazy.
And no downtime, and really get that fat that's annoying her to be gone. This may be the simplest, easiest way to do it.
Not for Thomas.
No more turtlenecks. I'm tired of doing this.
He's going for syringe lipo.
Stick your tongue out one more time.
A tough guy who's getting all that fat sucked out at once.
It's your one lifetime to live. Why not get it done now?
Less fat than it appears, says Dr. Davis, and he's got young age and quality skin on his side.
Not only is that fat going to go away, but the skin there is going to be tighter than it would have been if he didn't have this done.
And at $3,500, he says Thomas will be one and done.
You hear that?
I hear it, yeah.
Isn't that weird?
Hard for me to watch, but Thomas doesn't feel a thing.
How you doing?
Good.
Good. Good.
Pretty big.
How's Joyce doing?
I'm still standing.
The sight, the sound, the man jokes.
So we made you a D cup.
It's all done in about 40 minutes. They all left on this day iced, wrapped, a little red.
And you're good to go shopping.
2 weeks in, see how Audrey, Linda, and Thomas are coming along.
I can't believe it. Really, and no needles.
My family doesn't know I'm doing it yet, and all my siblings have double chins, so look out.
If it makes you unhappy, it makes you unhappy. Fix it, if you can.
Joyce Evans, Fox 29 News.
All right, keep in mind, those 2-week results Joyce showed us are not final. It's It's going to take weeks, maybe months, to see how well those procedures actually worked.
Very cool.